So now I'm going to show you the AED and what it looks like. This is what it looks like when it's brought to you in its case. Some of them are red, some of them are blue, but basically this is a basic AED. This is what we're using as our mannequin, okay? These strips will allow the AED to read and speak to us when it's time. When you open the AED, you will find there are some things in there for you. First of all, the scissors, very important. You must expose the chest in order to use the AED. Doesn't matter if they're a male or a female. You need to cut off the bra if the person is wearing one. Modesty is not something we should be considering at this point. Expose the chest. Once the chest is exposed, there'll be a wipe of inside. And take out the wipe. You may need to wipe the chest, or if the person is wearing a medicine patch, and it's going to be right where you need to place the pad, which would be on the right shoulder blade or on the left rib area, okay? If there is a medicine patch here, remove it using the wipe. Don't touch the pad with your bare skin. It is medicine and it will absorb into your skin. Remove the pad, give it a wipe. Now the person is ready for you to use the AED. The AED itself will talk you through everything that I have just said. It will also explain when it's going to give a shock. First of all, there are a couple of things that I want to tell you. When you expose the chest, you may see that medicine patch, which I said you need to remove. You also may find that there's a bump, something like the size of a deck of cards, under the flesh. Could be a pacemaker. If you need to give CPR or use an AED on this person, the pacemaker is not working, so the AED must be used, and it's okay for you to use it. It's okay to use an AED on a pregnant woman as well. What you would do is make sure you don't put the pad directly over anything that's in the body. So in this case, the pacemaker, move the pad to the center of the chest. If the person happens to be receiving some sort of medicine therapy, chemotherapy is what comes to mind, and they have a port placed in their body, a needle, do not place the pad over that port. Move the pad either up or down. Either way works. So now we're ready. Placing the person flat down, they're on the firm flat surface, the AED has arrived. The first thing that I do once the AED has arrived is turn it on, and hopefully you can hear it.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Remove that medicine patch, wipe it off, okay?
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Here are my
Look
pads.
carefully at the pictures on the white
There are
adhesive
pictures.
pads. Peel one pad from the yellow place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Here's the yellow wrapper, pulling it off. Place second pad.
When the first pad is in, no one should touch the patient.
Clear. Stand back.
Analyzing.
Don't touch. The machine is analyzing.
No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called.
Have you called
It
911?
is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
Well, isn't that great?
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
This will continue for a cycle of 5 sets of 30 compressions. At that point, the AED will prompt you to stand back again because it will be analyzing. Please understand, the AED cannot hurt you. The reason why we ask you to stand back and not touch the patient is because this is an extremely sensitive machine. If you're leaning against the patient, your hand is on their shoulders or anywhere around them, it could pick up on your heartbeat. And if it picks up on your heartbeat, it will not deliver a shock. I can push this orange button until the cows come home, unless this machine has picked up that a jolt is needed. It will not deliver that jolt. If you have any questions, please email me at rgeary@7hills.org.